Okay, we shall now start the meeting. So welcome everybody. Thank you for your attendance. The first item we have on the agenda is in fact apologies. I have apologies from Chris Williams, Joe Barker, and I'm not sure whether Yusuf has managed to join us or not. Paul, have you got him on?
Chair, I'm taking it that Councillor Darmash has given apologies. I have some further ones as well, from Councillor Chilvers, from Councillor Cook, who's been replaced by Councillor Mark Cargill, from Councillor Tracy Shepherd of Nuneaton and Bedworth Borough Council, from Councillor Judy MacDonald of North Warwickshire Borough Council, who's replaced by Councillor Marion Humphreys, and an apology from Councillor Cabourn, who will be with us as soon as he can. Thank you, Chair.
Okay, thank you very much. Any disclosures of pecuniary or non-pecuniary interests from members, please? Can't see anything, so take that as read. Then we'll go straight on to the first item or second item on the agenda, which is the RISE service update, which I think is being presented by Becky Hale.
Thank you, Chair. Yeah, I'm presenting jointly with Chris Evans, who is from Coventry and Warwickshire Partnership Trust. Do you want to introduce yourself, Chris?
Good afternoon. I'm Chris Evans. I'm the General Manager for Mental Health Services for Children and Young People in Coventry and Warwickshire Partnership Trust.
And for those of you who don't know me, Becky Hale, Assistant Director for People with Responsibility for Strategy and Commissioning, Warwickshire County Council. Hopefully people have a chance to look at the report, but we have got a presentation that we will take you through. So if you just bear with me and I will open that up. Okay, can you let me know when people can see that?
It's visible, Becky.
Okay, great.
On screen.
Obviously, I can't see hands up or anything now because I'm sharing the screen. So please do shout as
Becky.
Yeah.
We will take questions after the presentation.
Okay, thank you, Chair. That's really helpful. Okay, so I'm going to kind of make a start, but just wanted to kind of put this into context. So what we were asked to do was to provide an update on the transformation for children and adult mental health services, with a focus around particularly, obviously, children and the move to adults at this joint committee. So what we've pulled together is an update on the transformation programme that is currently underway, and also the COVID response. What we have done following a request is just provide a little bit of information about current activity levels, but wanted to kind of share with the committee that the performance framework has been stood down as we have gone through the COVID response. And as such, the performance framework is not due to be re-established until November. So I just wanted people to be aware of that, because obviously the usual information that we might share, we haven't got available at the moment. So just kind of a reminder for those of you who aren't aware, our RISE service is provided by Coventry and Warwickshire Partnership Trust and Coventry and Warwickshire Mind, and covers all of the things that you can see on the slide in front of us. So Chris and I are going to take you through a series of slides, and then hopefully we'll have time for plenty of questions as we go through. Chris.
Thanks very much. I guess that obviously one of the critical parts of work that has been consuming us since March and just before, obviously, was the unprecedented changes that we've faced in relation to responding to the COVID-19 incident, and obviously that there was a rapid and immediate need for the change of delivery, and to ensure that we had continuity of service and continuity of delivery. What I've listed here is a number of the critical factors that we changed and that we delivered as we went through that process, and I'll talk through some of these and give you some clear examples of that. There are a significant amount of these, and a significant amount of work has been done throughout the COVID-19 incident, and what I will do is give you a brief overview of some of those factors. So, I mean, first and foremost, one of the critical services for us to ensure is that we maintained our front door, making sure that children and young people in a time of unprecedented change, and for them a change of their schooling processes changed substantially, and obviously the admissions criteria for schools changed significantly, which meant that the vast majority of children and young people then became resident at home on an ongoing basis, being schooled. So we had to make sure that we maintained our front door services, make sure that we maintained our navigation hub as its access point, make sure that we maintained the delivery of our crisis team and the crisis functions, and also made sure that we could continue to provide the consultation and advice to children and young people. Certainly, the delivery of the front door services we knew was likely to have an impact. We knew that children and young people were not likely to be able to see the same care services or get the same support from schools or from general practice because of their changing criteria to protect from COVID. So we made sure that we were offered as a flexible approach as possible, where we would have perhaps in the past sought to have had a referral from a GP or for a school. We immediately made sure our processes could manage without any of that background information, and that we would try and support so that children and young people could get a referral to the service, and that we'd remove as many hurdles or barriers as we could to make sure that we were still live and active. Critical at this particular point was to transform our digital service and the digital offer, and I guess that the fact that we're all here today on a digital platform and continue meetings in that digital platform is one element of the changes that we had to make. But we certainly needed to make sure we had updated advice and guidance and support tools around COVID-19 and also around management of anxiety. We uploaded renewed video content, increased our social media presence so that there was many messages going out on social media. We looked at making sure that the Dimensions tool was live and active, and we've delivered that and delivered Dimensions in a newly formatted Dimensions site. And we continue to try and look at ways that we could deliver our services in a digital and virtual way. Certainly, we've introduced a digital consultation platform called Attend Anywhere, which is the NHS's secondary care solution for being able to do consultations for children and young people. And we've looked at digital group work as well. So we're progressing with Zoom Professional to be able to continue some of our group work in a digital forum. Obviously, the transformation of that is a significant ask for all clinical professionals, because obviously we're moving towards stuff where we would have seen people ordinarily face to face to continue some of this work, and we had to transfer that either to telephone and to a video platform. We've also tried to look at making sure that we continue to provide webinars and information for children to be able to enhance their emotional well-being, looked at providing resource packs and support, and obviously we've continued to provide consultations for children and young people and for professionals via this format. Our primary care team are doing some work around that at the moment and took all of their consultation and training stuff onto a digital platform to be able to deliver like this. And actually they are, from today, we roll out an actual e-learning portal, so schools and professionals will be able to do a training program via this. So a huge amount of work gone into our digital work. We expanded our services and offer in the crisis offer, and certainly it was critical for us to be able to ensure that actually urgent cases of need could be responded to. We expanded the core opening hours of our service from 8 AM to 8 PM, working from 7 days a week, and actually our crisis team was at the time embedded with our navigation hub, so they used to occupy the same location, the same point, but very rapidly at the outset of COVID, we couldn't have two critical services occupying the same physical space for obvious reasons. When we have a contagion that can be spread by touch or by saliva, two of our critical services occupying the same space was untenable. So we also that team had to endure a move, and we moved out to one of our community bases, and so they so that we could enable them there. We also enabled a 24-hour, 7-day-a-week telephone advice line, crisis advice line, and so that was enabled at the request of NHE. This was something that was in a programme of works within the LTP that would have taken place over the next 2 years, and we had just over 3 weeks' notice to be able to get that mobilised. And we have a range of clinical staff from our crisis team who man the phone calls directly from 8 until 8, and then overnight that's triaged by our services, our adult services, and they actually have an on-call facility then whereby we have a CAMHS clinician on call, have a CAMHS clinical manager on call, and there's a CAMHS consultant psychiatrist on call. So we made sure that we'd enabled a very robust 24/7 operating framework. We obviously had to make sure that we reached out to all those that had been referred into the service and who were open to the service to make sure that they knew what was happening, they knew about the changes, and we wanted to actually make sure that we had contacted everybody that we were currently working with and who'd been referred in for mental health services and mental health support. So we undertook a significant amount of piece of work to do that. We also had to make sure that we understood the risks that were posed by COVID-19 to those people in our communities, by those young people that were accessing our services, and obviously our staff as well. So we had to make sure that we undertook the appropriate risk assessments across all of our workforce. And obviously these changes in working practices very much for staff are very difficult at times. It's, you know, we are asking people to work in very unusual situations away from their team. So making sure that we've got an appropriate framework in place to be able to support staff through this work and through the work that they're doing for children and young people was a priority, and as a trust we did mobilise that support. We obviously talked about the primary care workshops, and I'll talk a little bit about those as we go forward, but we are continuing to provide support to a range of people with additional vulnerabilities, making sure that we've offered and supported in self-harm, and we've talked about a digital workshop that we delivered over during this time where we've had over 1,000 attendees at that. We certainly have continued things like recruitment into the Youth Justice Post, and we provided additional clinical support to the MDT for the children looked after. Communication is a huge part of what we needed to do during this, and we've joined forces with our commissioners, and we've had a joint commissioning and provider communications meeting to make sure our media strategies are out there, that information continues to be out there. And obviously we've continued to ensure that we engage children and young people in the services and what they're doing. But obviously throughout this we had to change the structure and functioning of our working, and whilst at the outset of this we had no idea how much of our resource will be deployed towards core activity to be able to maintain the NHS and services delivered at a critical level, but actually at this current point, and obviously the pandemic is ongoing, and we are at a point whereby we're seeing much greater concern, rising numbers, and continuing to see changes in tiers of freedom. At this moment in time, in terms of RISE, all of the workers that were deployed for children and young people at the outset of this, who were doing their work within the RISE contract, have continued to be work for the RISE contract and for CYP. I've not deployed anybody anywhere else, and at times we've had additional support from other areas, so such as the crisis team overnight. So overall, we've done particularly well during this particular incident. So that's a whistle-stop tour to some of the changes that we've done and an overview. So back to you, Becky.
Okay, I'm trying to still find it. Might have to, sorry, I'm going to have to reshare and start again. Okay, can you see that? Okay.
Yep. Okay.
So as Chris indicated, while all of the practitioners within the RISE service were focused around continued delivery of RISE. As indicated earlier, contract and performance regimes were stood down and are only now beginning to be stood back up across the NHS and with CWPT as well. So this just provides some of the data to give people a sense of the impact of COVID-19 on activity within CWPT. So what you can see is the waiting times for assessment. So as you can clearly see from the chart, a real drop off in terms of activity once the pandemic hit us towards the end of March, beginning of April. But you can see from here a real focus around the delivery of support to people between 0 and 6 weeks. This gives a sense of activity and completion times where referrals were made into acute liaison, so for young people in crisis. And as you can see throughout the COVID pandemic and across each of the areas, there has continued to be 100% performance, ensuring that those young people in crisis are given appropriate support quickly. This just gives an extent of activity when you compare June and July of last year to June and July of this year. So you can see actually that there's been quite a significant increase in hours of clinical activity, and that was following a call to action, ensuring that referrals were still coming through and that children and young people were still able to receive support that they needed. And this gives you a sense of the real change, and Chris has alluded to some of this around the response to the pandemic, around activity profiles and the mediums in which young people have been accessing support. So what you can see is June and July of last year compared to June and July of this year. And obviously what is apparent is the increase in telephone and particularly video consultations when you look at that green bar on the chart. What's also, I think, important to know is that face-to-face activity has continued throughout the pandemic, and those children and young people who have needed to see their clinician or access support face-to-face have been able to do so. Moving on then to the long-term plan. This is just a reminder, and we're going to go through all of this in a bit more detail, and you will have seen it in the paper. But these are the elements of the local transformation plan that we are working on, and that is across Coventry and Warwickshire. And what we've drawn out here is some of the Warwickshire focus, and particularly the focus around RISE. So there is the breadth of access, timeliness and effectiveness of the offer to children and young people 0 to 25. We'll go into that in a little bit more detail. The approach to resilience within schools, eating disorder pathway, the approach to mental health crisis, developing the digital offer, strengthening support to vulnerable children and young people, strengthening the approach to data collection and analysis, and ensuring the voices of children and young people are embedded in CAMS development. So over to you, Chris.
Thank you. It's just my computer takes a moment to unmute itself. So certainly part of the ongoing priorities across the transformation plan is around schools approach, and obviously we were part of the initial pilot for mental health in schools teams. Obviously those workforce and the change in the way of schools changed some of their functioning during the pandemic, but what they continued to do was to support children and young people, and they continued to provide support to people who were needing sort of emotional support and needed group activity where that couldn't be delivered. They continue to see children and young people. They continue to reach out to schools and provide support to schools, and obviously now that we are in a point whereby we are re-enabling schools are back to their sort of more normal operating function, we've re-engaged inside the 18 schools that we were in, and we have a new project delivery document which will see us at the target range of 49 schools by the end of the year. This is an ongoing ongoing project that we're involved in, and obviously we continue to liaise with Health Education England and NHSC throughout the period of the pandemic around that. But we have continued to use all of that workforce to be able to see and support children and young people. The mental health in schools teams were very critical for us in terms of the delivery of some of our social media content and some of the information work that they did as well. So they were a huge help in terms of their support and understanding, and being very close to children and young people in terms of the support they offered. The community partnership works. Obviously, when we at the community partnerships we used to have, we were in 5 hubs across Warwickshire. Obviously, face-to-face hubs were not something that actually could be delivered in the same way through the pandemic, and we've converted a lot of that activity onto line, so that actually parental workshops could continue to grow, and we've continued to use our primary care team to support those hubs and that delivery. Certainly, we are continuing to work with the Bernardos, who are actually obviously running the family centres, and obviously we link into partnership work, quarterly partnership meetings that they have with a broad range of voluntary sector groups, in terms of being able to make sure that the offer that's around and available for children and young people is understood by all, and that we actually are making sure that we advertise around the whole range of partnerships that are there, delivering to children and young people what is available. Certainly, part of the work that we wanted to do around community partnerships was to continue to try and grow new ideas and new delivery, and certainly as we've done so, the commissioners had supported us with a growth of a partnership in the Nuneaton and Bedworth area. That was at its infancy at the point that the pandemic sort of arose, but they had a first meeting in September. We've got a range of providers that are currently engaged in that partnership, and we continue to make sure that we engage a whole range of people around supporting children's emotional and mental health needs, and that's something that will continue to be extremely important to us as we go forward into the future, because actually having that broad range of understanding of the range of need, because we believe that will have grown and the range of need will have grown, so we need to ensure that actually we have a broader range of services able to support children and young people, and the partnerships model that we were involved in continues to grow. The hub activity that we couldn't do was something that was was a challenge, but certainly when we look at the number of consultations that we would have done and the number of parent workshops, so actually since the beginning of September we've seen 85 parents come through workshop activity with primary care, and we've seen 71 individual parent consultations. So we continue to provide that, but we provide it at the moment in a virtual way. Certainly Bernardo's are looking at reenacting the hubs, but that will be on a one-to-one basis, and so we'll have to look at our operating model and how we might fit in with that. The next slide is just in terms of our vulnerable children's offer, and obviously we continue to work around some of these areas that we will deliver. Certainly we offer a differentiated approach around self-harm and self-harm support. We have education via schools programs, primary care and primary care support. They do a training program around self-harm, and then obviously because self-harm is such a broad continuum of experience for an individual, we have to have a range of options available to us. So that starts at an education level into the continuum and moves up to primary care support, to actually seeking a consultation via the navigation hub to talk about a specific incident and to look at how that might be managed. We might have call cams involved if somebody's currently open, or actually if they're not, we may involve the crisis resolution and assessment team, or if that self-harm is something that necessitates a physical intervention, then obviously we have the engagement of the acute liaison team, which are part of our crisis service offer, that will go and support and make sure that people are seen in the acute sector. We continue to support and develop the offer by the crisis team. The long-term plan and the local transformation want to look at a review of that. We're undertaking a review of some of the evaluation of some of the changes that we made during COVID. But obviously what we need to be able to do is to look at, well, how does crisis in the system get supported as we move forward? And certainly we are involved in supporting that. During the pandemic, we've recruited to an additional post in a post posting in the youth justice team. This was a vacancy factor that we had, but we've increased that to a full-time post now permanently, and that's now been recruited to, so that will provide additional support for the youth justice service going forward. Certainly we've deployed throughout the pandemic and continue to look at the model that we provide for children who are looked after, and we've been trialling a model of MDT working in additional support from our clinical specialists for children looked after, and working alongside Coventry and Warwickshire Mind in the delivery of that service. Certainly at the moment there is, as part of that work, is obviously we need to look at a review for the offer for unaccompanied asylum seekers. This is a looked after population who have very specific needs, and certainly the clinical lead that I've engaged in terms of supporting the children looked after service currently is actually involved in the migrant mental health pathway in Coventry as well, and obviously she has some expertise around war and torture, which is a particular part of the trauma that these children would have experienced, and is an important part of how we develop that offer. I think that as a local transformation board, Warwickshire have developed a refreshed framework for that to be able to sit within the board, and that will get discussed at the next available operational group meeting. In terms of the crisis offer, I've talked a bit about what we've done and what we've changed in our evaluation, but certainly there is a feeling that we need to make sure that we review the system that's available from all levels to be able to support children at the earliest point, and to make sure that they are supported at a point of crisis. Our crisis line, as obviously which we accelerated, is part of a programme of works, as I've described, that will exist in the transformation of children's crisis work services. But I think it's really important that we make sure that we understand and we learn from what's happened during the pandemic, that we think about children and young people and think about what is their need now and how that might have been different and what their experiences might have been different to provide for this. So as part of the transformational bid, the LTP has put forward a request for some funding to be able to actually get a voluntary sector or a third sector provider to do some really detailed engagement work with a whole range of children and young people, some of those that will have been involved in those services, but some of those who will have never touched our services, because I think it's really important that however we build our crisis structure and however we respond to the long-term plan, that we actually build it making sure that we understand what children, young people and families think is helpful to them, and I think that is an ongoing part of our delivery for the crisis offer.
And I guess just to add on that, helpful that we've received confirmation this week that our bid has been successful, and we've got 55k allocated to do that piece of work, which is really good. Moving on then to the 18 to 25 offer, and people will be aware that this was a key part of the RISE contract and remains a key part of the transformation plan. So currently the RISE services focuses around children and young people aged 0 to 18. And we've had an ambition to look at the 18 to 25 offer to support young adults for some time. It's fair to say that we are a little behind where we would have wanted to be, and that is partly because of the pandemic. So we are now focusing from September of this year to September of next year, work to start bringing together what the 0 to 25 offer for mental health will be, and really looking at how we integrate that. We've got some additional resource that's been allocated to support the project and the programme around that, and then we'll need to start looking at what the business case is around additional resource that may be required to support the delivery of that offer. Another key area of focus at the moment that people will be aware of is the development of the PAIRS site. So we are actively working across the council within social care, within education, CWPT, about the opportunity to develop a more holistic multi-agency and integrated offer utilising the PAIRS site. People will be aware that the PAIRS site has two elements to it. So there is the school site, and then the site that provides the opportunity for us to deliver services in a different way. So some of the things that we're planning and progressing with at the moment, and doing the work around detailed business cases, is to look at 72-hour residential provision for children and young people with emotional and mental health needs and autism, family interventions and day provision for children and young people, how we might be able to strengthen the crisis support offer using the PAIRS site, increasing and accelerating the coordination of social care and support with education provision on the site. So we are busy working those through at the moment and aligning that with education colleagues to ensure that we can start to make that operational from September of next year. Chris.
Thank you. So the last three items here in terms of the LTP, which to talk to, obviously within the long-term plan there was always an aspiration to expand the digital offer. Without a doubt, the acceleration of COVID has accelerated that at a pace that we didn't anticipate prior to COVID. But obviously we are using the Attend Anywhere platform. We are using it significantly. I've obtained an update this morning in terms of our usage around that. So at the moment, the national average for digital consultation and digital work at the moment is around 20%, and I believe that we're currently at around 36% in terms of our use of a digital platform to be able to support that. That I think is obviously supports our ability to be able to see people when there's a clinical imperative, but able to be able to balance that with a digital offer that exists as well. Certainly, we're trying to look at trialling now accessing for young people to be able to access support or access sessions at school and within school time, because obviously there's an imperative from a school point of view to continue education, and bringing people out for appointments is obviously a difficult challenge. But if we can actually work with schools and work across that, then that will be really a really exciting venture. Obviously, it's a complicated world in terms of the digital governance framework when you get into that work within schools, but our MHST teams are the people that are currently leading that way for us to be able to support that and be able to help learn the lessons so that we can embed that in a wider part of RISE. Because of the digital platform and the world that we're in, we've worked in partnership with a private company called Helios, which has been part of our offer for a long time. They offer digitised CBT therapy and other interventions, and they've been a useful partner for us and are involved in a range of national work. They have a digital platform which has some real distinct advantages in terms of the outcome measure work, in terms of how we are able to access and how clinicians are able to work on screen, not just have a video platform where they're trying to do all the work to the side of them, actually to be able to do that work as you go through. We are currently in the process of looking at a pilot around that work and looking at using that clinical platform which we have developed and progressed during the pandemic. And finally, the e-learning platform, we knew that obviously schools would have a limited ability to be able to engage in training packages. We certainly, whilst converting our packages online, we've had good progress and good uptake from that from the beginning of September. I've had 123 professionals online with primary care to date, in consultation, in work, in their training programs, 44 members of staff from schools across Warwickshire. And looking over the next 2 months, I've got 259 professionals booked and 101 professionals from schools booked to be able to attend those training sessions. So the e-learning stuff and the e-learning work is really important. But what we recognised is that actually with schools and the pressures within schools, we needed to be able to develop a training platform. That's been a complex programme where we've used our digital enablers to be able to put our content into a training programme, and actually that is live from today for them to be able to engage within that. And our primary care teams are working with some specific schools just to do the final testing, the final feedback before we go fully live and share that across all networks. So that's a really exciting part of work that's done. The National 4-Week Trailblazer pilot that we have in South Warwickshire, that work and the programme of work around the delivery of that and the evaluation of that was suspended during the pandemic. The staff from the national team that were involved in that were redeployed elsewhere, but we obviously were involved in a work programme of work and evaluation of that, and that has been reenacted. We met last week to look at our action plans around that, and we'll continue to push that work forward, because obviously that will become an important part of the national picture about how the government will invest in children's mental health services going forward. The eating disorders pathway, is something that we obviously has been part of the LTP, the long-term plan, for a significant period of time. There is a growth nationally in the prevalence of eating disorders amongst children and young people, and unfortunately the pandemic did nothing to change that for those people. And actually what we've seen across both adult and children eating disorders is that the restrictions and the control issues and the fears around food and the ability to be able to so much focus on what you could buy and what you couldn't buy has really had an impact on children, young people and adults with an eating disorder. We are involved in modelling out how that might look in the future, but we've also been able to make sure that we are responding to and have submitted bids to the CCG to be able to look at how we're responding to current demand and current support, and we are working to make sure that our team can continue to provide the support that it does and to meet the frameworks that are set out in the Commissioner guidelines for eating disorders. So that work has been ongoing, and as I say, those plans have been developed during the pandemic.
Right. So just to summarise, I think there has been a number of challenges, and as we've outlined going through, responding to the pandemic and its impact, and I think we all recognise that starting to understand the impact longer term of the pandemic on children and young people's emotional and mental health is going to be quite significant, and something that we're going to need to really start to understand. I think we already know that complexity of need is increasing, and we need to be able to work in different ways to be able to manage the resources that we have and support an offer that will respond to that increasing demand and that complexity in presentation. There is also obviously the elements around people with autism, which we will pick up in the next presentation around that. Lots of challenges around some of the things that we would have wanted to do quicker. And we had plans in place, but as a result of the pandemic were stood down. So some of the transformation plan objectives have been halted, and we are in the process of implementing them back at different phases. But some of the timelines that we're working to have obviously been changed and amended. As Chris has mentioned a number of times, particular pressures around meeting the needs of young people who are in crisis, and how we will develop that offer moving forward, particularly in light of the impact of the pandemic longer term, and those children and young people with eating disorders where there is continued and significant pressure around the demand for support, but achievements too.
Thank you, and I think that it's fortunate for me to be able to talk about our achievements. Certainly, we have responded in every way as quickly and as promptly as we can. We delivered a head teachers forum with early help, in conjunction with early help, around talking around what was available, making sure that people understood the front door was open for services, and obviously offered to be able to go back. What I want to be able to continue to do is use the benefits of this digital platform to be able to talk to make some of those connections that may have been more difficult because of geographical nature, because actually we're all in different places, to be able to bring us together in a more seamless way. And we continue to offer that support, and hopefully at some point in November we'll have a further head teachers forum now that they've had children and young people back in school, and get some real further information about that. Certainly in terms of providing around self-harm, we were part of a system with commissioners where we provided in July, August and September 5 sessions across the whole of the sort of the professional system for webinars that were targeted at parents, teachers, parents, carers, professionals working with young children and young people, and we had over 1,000 people there where we talked around self-harm. We talked about the importance of talking to children and young people, and we talked about some of the strategies and support and how to get help and how to be able to manage and support in those concerns. That was a phenomenal effort from some clinicians within my service who and within CWPT who rallied to get that up and running, and were prepared to put themselves in front of 1,000 people and raise all of those questions. So a great achievement for them. The implementation of the crisis line and the speed at which we did it, the call to action that I made to my staff in terms of being able to respond, to go from working, a sort of a 2-shift pattern to being available on call 7 days a week, 24 hours a day. They've responded to that. They drove to the call of action without any question, and we continue to support them through that. But that delivery has been really valuable, and we've continued to develop that as we go forward. The digital offer achievements, I think, are huge. I think that we've made some real progress in those, and I think that we want to learn what actually is best. We're not for a moment suggesting that digitally will be all of the future, but actually there are some real benefits to it in terms of creating a blended model. The primary care team would tell us that actually the consultations that they're having with parents and some of the sessions are much better attended by doing it digitally than actually people having to drop in somewhere, because it can be done in the conjunction of their own home. It can be done while trying to balance the pressures or the needs of other siblings. So some of these things are really powerful tools which we want to be able to continue to deliver. Obviously, our community offer and looking at the schools, we've done some work around what support and where the gaps, and certainly we are continuing to make sure that we audit and look at what's there. We want to make sure, and we have continued to seek the child's voice in these networks. We've continued to ask what children and young people want, and obviously as part of a system we've supported and helped the delivery of a programme that will specifically get some funding to go and make sure we talk to children and young people and find out what we need and how we plan services going forward. I'm obviously very proud of the work the primary care mental health team has done with its training, and definitely the work they've done to be able to develop an e-learning platform and to get all of the system enablers to get that done. Most of all, I'm just incredibly proud of the efforts that they've put themselves to, the work that they've done, and the fact that they have continued to work in very difficult and challenging circumstances to be able to deliver to the children's mental health agenda for children and young people across Coventry and Warwickshire.
Thank you, Chair.
Okay, thank you very much, Becky. Right, we're now open for questions. If you would indicate in the usual manner with the hand system. Until then, would you please, unless you're going to speak, remain muted. The first member I have is Helen. You have got or had, I think, 4 questions. If they are still relevant, would you like to take them up now, please?
Yeah, thank you, Chair, and thank you to Becky and Chris for that update. And I realise that some of my questions have already been covered to some extent, but I will just repeat the questions, and if there is any more detail you can give us, then that would be really good. So the first question relates to mental health in schools teams. Just if you could give us a bit more detail about why the bid for North Warwickshire was unsuccessful. Okay. Secondly, Community Partnerships 4.9, in relation to mental health partnerships, what has happened and who knows about this? In relation to the RISE, I know you did cover this, why the offer for RISE for age between 18 to 25 has been delayed. I know you did talk about many of the reasons were due to COVID. Is there anything else that you can add to that and give us maybe a projection, a bit more of a timeline about when that will be introduced? And finally, and I know you did say, Chris, that the digital offer, this relates to 4.2, the digital offer was up to 20%. Does that mean 20% of schools have taken it up? If you could just clarify perhaps how many schools have taken advantage of the digital training platform so far? Thank you,
Helen. Thank you. Becky, Chris?
Yeah, okay, I'll start with the first one then, Helen, around mental health in schools. So we've got 2 across our STP footprint. So we've got the South Warwickshire scheme, which is Warwick and Stratford, and then there is also 2 that operate in Coventry. We put the South Warwickshire bid in first, actually. Coventry was after that because of the demand and the rates and the activity around children and young people's mental health in the south of the county. We did put in the bid for Warwickshire North. I think there was a couple of reasons that it wasn't accepted. I think the key one was that actually as an STP we already have schemes in South Warwickshire and Coventry, and there were STPs across the country which didn't have any. So on that basis, they were looking at how they could support other areas to at least have a pilot in place. I think the other view was as well that actually the demand isn't as high in Warwickshire North, and on that basis, those were some of the reasons that we were given. Obviously, we continue to kind of progress and look for opportunities as to how we might be able to roll out the learning and the approach, and any other opportunities we get to put forward bids for Warwickshire North, we will.
And certainly prior to the COVID, we were expecting the waves for mental health in schools teams to continue to flow from NHS England. So we do expect the opportunity to submit further bids for further mental health in schools team projects as we go forward.
Chris, do you want to take a question?
Yeah, just in relation to the partnerships, obviously I've explained that the partnership activity where we were operating in hubs went to a digital process, and we went to a platform around that. We continue to work with Bernardo's, who are in the family centres and running the family centres, because they are actually supporting a partnership approach as well. So we continue to engage within that activity, and obviously we are looking at how we might continue to strengthen our connections with the voluntary sector group. And certainly there's a pilot in Bedworth, which is in its early stages of development, where we had their first full meeting took place in September, and obviously that's again aiming to look at sharing best practice, advocating on behalf of children and young people. And certainly there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 different organisations involved in that, including Warwickshire County Council, ourselves, Aspiring Arts, Warwickshire Carver involved in it, Young Carers, Dare to Dream, Life Space, Doorway, Sycamore. So there's a range of different providers that we're trying to enable, because to ensure that within those localities we understand what's available and what can be support can be accessed.
Picking up then the question around the 0 to 25 offer, obviously adults who are aged 18 to 25 continue to receive support through adult mental health services, but we are committed to doing the piece of work around looking at the 18 to 25 offer as part of the development of RISE. So we've identified a technical specialist who is supporting us with the development of the project plan and the business case. We've started the mapping of services for adults who are 18 and over. We're doing stakeholder mapping and developing our business case with a view to looking at implementation by September of next year. But it is something that we've only picked back up in the summer of this year. So that is now the kind of timeline that we're working to.
One more, I think one for you, Chris, about digital training.
Yeah, so no problem. And in terms of the digital training platform, so in terms of the number of schools that have engaged within all the different schools, I don't have the breakdown of schools. What I know is that certainly since September, I've had 44 professionals from different schools that have come through the training programme, and certainly I've had another 123 different professionals in that. The e-learning programme that we're going will give us a much better idea, and I'll be able to share that at a further update. But obviously our digital framework and the percentages around the digital platform that I spoke of, that's around actually the total number of contacts that we use, what percentage of those are delivered digitally versus face-to-face versus virtually. And as I say, we have continued to grow that nationally. There have been the uptake of digital platforms has only seen that rise to 20%. For us, we've been able to grow that platform usage up to 36% at the moment. But obviously that's we combine that with digital face-to-face work, which is similar to what we're doing here now. There's telephone work and there's still growth in face-to-face work. And as we enable our bases in terms of their COVID security, we'll see people where there's a clinical imperative to see. And the longer this goes on, the more the clinical imperative, and we'll balance seeing people with a piece of digital work, then we may see them again and then go back into a piece of digital work, and we'll balance that, what we'd call a blended model really as we go forward.
Thank you. Helen, did you want to come back at all?
Yes, Chair, thank you. Yeah, thank you for that update. It's just a bit concerning relating to the RISE offer for 18 to 25 that it's going to now be next September. I mean, this is an important offer, isn't it? So we don't want children to young adults to suddenly sort of go into mental health resources that perhaps aren't there. You know, they sort of drop off the edge of a cliff almost when they're 18, and that offer isn't there. And if we're going to have to wait another year, that's going to have a big impact on young people. Is there any way we can speed that up?
I think it's important for us to pin down the various elements of what we're looking to do. So I'm sure colleagues will jump in, but actually in terms of referrals for young people, particularly those young people who are 17, there is always a clinical decision as to whether they should be supported within children and young people's mental health services, or actually should go straight into adult mental health services and be supported through that route. And obviously there is a adult mental health service that does support and meet the needs of younger adults who are 18 to 25. So we're looking at how do we begin to bring that together, and what are some of the additional things that we might want to wrap around an offer that becomes a 0 to 25 offer. So that there's kind of different elements to it in terms of what have we currently got in place and how do we integrate that. So children and young people's mental health services and what we've got in place for adults are delivering a more holistic and kind of streamlined service for young people as they move through. And then actually, what is it in addition we may need to resource to be able to support and enable our younger adults to have access to support, hopefully, in the community and outside of specialist mental health services. So there are different elements to it, and I suppose it's the whole 0 to 25 offer that we expect to be delivered by September, but there are elements of it already in place, and that's what we're working through as part of the business case. I don't know whether there's anything that Jed you might want to add, or Chris.
Yeah, I was going to reiterate one of the points you made, Becky, which is that in relation to 18 to 25-year-olds, there's actually quite a comparatively small proportion of children, young people that actually meet the threshold of our secondary mental health adult services, and there's quite a proportion of those young people that get whose destination primary care or voluntary community sector organisations. So as Becky's saying, part of the work that needs to be done is looking at the offer in the round, the whole system, which includes CWPT provision, voluntary community sector provision, primary care provision, social care provision, looking at the whole system. But again, as Becky's highlighted, there is provision in place at the moment. So we do want it to happen as quickly as possible in terms of this transformation work, but there is provision in place, and it has to take account of the full gamut of offer for 18 to 25-year-olds going forward.
Okay, thank you very much. Kate.
Thank you, Chair. I have 3 very, very quick questions. The first one is, you mentioned the telephone line 24-hour a day, 7 days a week. Is this just an emergency line, or is it a line where someone can be triaged, and is it another way of getting onto the system? My second question is that clearly there's an increase in the use of telephone and video, and clearly it's cutting down on the waiting lists. And is this obviously a way for the future? And my third question is, so you mentioned 18 schools in September with 49 by December. Could you tell me what percentage of schools that 49 schools is, and does it include primary schools as well? Thank you. 3 very quick questions.
No problem. So I'll answer those questions. So in terms of the 24/7 crisis line, that is available. It is a crisis line. It's there to be used as as an emergency, and it's to for parents or children and young people to ring through. What you would access, as I say, would be a mental health professional. So you go direct to an NHS mental health professional during the hours of 8 a.m. to 8 p.m. 7 days a week. That's directly to a clinician within the crisis team, the children's crisis team. Overnight, that's triaged by the adult crisis services team, who then will speak to the person, find out what the nature of the problem is, and then will either liaise with our on-call children's worker overnight and the on-call manager that's needed. So we are there is a potential that someone was to phone up, and actually if you were to phone up and be at a point of great need, then actually the whole point of that is that a response would then be initiated from that. We clearly are not trying to use that as the front door. We want to use the navigation hub and the consultation route to do that. But obviously if something critical was to happen on Sunday evening at 5 o'clock in someone's home, then actually you can get access to that support. You can get access directly to an NHS clinician who will help then navigate and understand the nature of that problem and that difficulty. In terms of the increase in the video and the telephone consultation, I mean, I think it's a balance. We were thrust into an ability to be able to deliver via this means, because actually seeing people face to face and bases and accesses became something that was very challenging. Clearly, we have to wear PPE in the NHS, and clearly trying to deliver a consultation or a therapeutic intervention behind a mask is something that is a real challenge for us. So the digital platform is a useful model that we can see would be part of a blended approach. So it won't be, we still will do face to face, and we still continue to do face to face, but we have to look at the value. One of the things we are trying to understand is actually the efficacy of that, because actually you want the sessions to still be as good as they were when they were face to face, and that's part of the work that we're doing with the Helios platform, because that's actually brings us some other tools so that we can share virtual tools online and talk, and you can save stuff online from your rating scales and from some of the questionnaires. So certainly we're trying to make sure that we've got a good offer from there, but obviously what we need to look at is it as effective, is it as efficient, and can we still particularly continue to move people through? But we are not lost on the values that might bring, but it has to be balanced, because we still want to connect with children and young people, and some interventions, for example our art therapists, they need to be in the same room, in the same space. So that work we are re-enabling, but we are trying to look and be as creative as we can, and I've been very impressed with how creative my teams have been and my clinicians have been in trying to make sure that we do the right thing using these new platforms. And your final question, which was the 18, so the mental health in schools team programme, the South Warwickshire, I believe it doesn't represent all of the schools that exist within South Warwickshire. I believe that there are 75 schools across the entirety of South Warwickshire, but it does cover primary and secondary. Those schools were identified by education. They went through a process of looking at the JSNAs. They looked at all of the need that existed, and those schools were selected by our school improvement education partners for that programme. What we would hope to see as we continue to get more and more waves of mental health in schools teams, that we would grow those. But obviously the mental health in schools team is what we would call a schools approach, and we have other schools approaching RISE. So we have the boomerang, and we have the big umbrella, which are two other whole school approaches. So when we get a referral in for looking at a school, we have looked whether, well, have they got MHST, have they not, what do we need to do, would we use boomerang, would we use big umbrella? So we have a range of whole school approaches. So the fact that some school isn't in the MHST programme doesn't mean that they can't benefit from some of the whole school approach. And certainly some of the work they've done, if you like, on the media and the packages that we did, we made sure that we shared across all schools, so everybody benefited from those workforce and from some of that work.
Thank you.
Thank you. Do you want to come back at all, Kate?
No, I'm fine.
No,
thank you, Wallace.
Thank you very much. Sally?
Yes, thank you, Chair. Also, again, on this 24/7 helpline, I've visited a few websites and it's not clear it's 24/7. And other websites just quote 8 a.m. to 6 p.m. It needs to be transferred to your website so people know that if there's a crisis at early hours of the morning when things always seem a lot worse, that they know that they can dial that number 24/7.
Okay, thank you. You'll take that on, Chris, you'll take that on board?
Take that on board. So we're in the process of continuing development of comms. There'll be changes to the access point of that during the coming weeks, but and the re-communication around that. So we will work to look at where that exists, or where the information says it's 8 or 6. But I'm happy to take that back and look at where information is. But it was a rapidly put in place, and we've continued to advertise and make sure that it's there. But obviously, as with some websites, they grab a piece of information, then it doesn't refresh. So we're happy to have a look and see what we can find and make sure that we've got the current information there.
Thank you very much for that, Chris. Okay, well, I have no further hands up for questions. So, Becky, Chris and Jed, thank you very much indeed for the report.
There's loads of
Sorry,
hands.
Chairman,
my
hand's
There's
up.
loads of hands up.
Well,
I did have my hand up.
I can only have one person at a time.
I did
And
have
now
my
all
hand
of a
up.
sudden, Jeff.
Thank you. We are in year 4 of a 7-year contract now with CWPT. Do we have specific CAM services for children in care leavers, unaccompanied asylum seeking children? I mean, I recognise the latter is probably a fairly special area, but I just wonder if we are providing a service for those groups, and if so, how's it going?
Thank you. Yeah, we do provide, we have a specific children looked after service that is delivered by Coventry and Warwickshire Mind in conjunction with us within RISE. We do provide a support through that model and through that model into CAMs if needs be. We are always working to try and look at how we might develop that model, and certainly one of the pieces of work we've done last year was looking at our clinical model and the clinical support to that. As I've said, throughout of the whole of the COVID experience, what we've done is been able to use this digital platform to enhance the clinical support to that, and we'll continue to review that and to look at how the service operates. Certainly in terms of unaccompanied asylum seekers, they do get referred into children looked after. They are classified as children looked after, and certainly we have to think about what their needs are. Currently there's a discussion around this that I'm engaged with commissioners both from Coventry and Warwickshire looking at children looked after services and how they for unaccompanied asylum seekers, because there is a specific question for me around how we meet their needs, and actually have we got the skill set, have I got the workforce to be able to be able to deliver to that, and to make sure that we are supporting children and young people who are unaccompanied and who have come from some of the most horrendous circumstances and travelled across the world. It's a really important issue. We are engaged with our children looked after services. There's a regional group that works to be able to look at that work, and we're involved in that to make sure that we offer services and that we offer support, and that's in line with what we should expect. So we benchmark some of that provision across the region, and certainly Rob Sabin from Warwickshire and Richard Lynn from Coventry are engaged in that work regionally, but we do have a service and we do offer that.
Thank you. I've now got 3 further speakers. Mike Bain. Are you there, Mike?
He's left the meeting. I think it was Margaret Bell that was next.
Oh, sorry. Margaret Bell. Margaret, are you still with us?
I am, Chairman. Thank you very much.
Okay.
Thank you. Yes. Well, first of all, thank you for a very extensive account, particularly of how you've coped during COVID, and well done for that. I just want to go back to this mental health support in schools, and I was rather surprised by Becky's response on this. In the days when we used to get data, and it used to be broken down by district and borough, we were always very worried about the waiting lists and the demand in the north of the county, and the fact that it wasn't being met. The waiting lists were horrendous, and I find it difficult to understand why you said that the need was greater in the south. Now, I would like to think that we are driven by data and identified need. So there may have been lots of reasons why that bid was put in first. Who am I to say? But I can't believe that it was because the demand in the south was greater than the north. So that's the first thing I'd like to say. I think the other thing is, on the digital offer, this does give great opportunity, particularly for staff training and for parent and carer support. And I think that's fantastic, and that ought to drive ahead. In some cases, of course, it's also good, I think, for therapies. But I think what we should remember is that some children or some young people's anxieties are tied up with having to work in a digital world, and it is part of their condition, and we need to be able to recognise that and accommodate that, because particularly when they've not been in school and they've been asked to work digitally, this has just added to their problems. So we do need to be really sensitive to that. The other thing I'd like to say is you've mentioned eating disorders have gone up, and I'll just link into that self-harm as well. Now, I'm no expert in this, but it may be that early help or lack of it is one of the reasons for this. And I don't know how we can be assured that early help, what it means, and is it happening? Now, so for me, it's a combination of two things. One is the threshold for help. How bad does it have to be before we actually do anything? And I've always been worried that that threshold is far too high, which is why we get really critical cases, because we don't intervene early enough. And the second part of that, of course, is the waiting time. So we, at some point, we do need to get under this. Are we providing early help, and how are we providing, and what data would assure us that we are? And just on one general point, there was a general lack of data in this report. You did provide some of it in the presentation, but it was a little bit too small to actually look at, and certainly not enough time to study it. So it is helpful if we can have data to support some of the statements. And we were worried when we moved over to RISE that we would lose the granularity of the data across districts and boroughs. We don't want to lose that, because it's important that we know where the pockets of problems are and that we can address them. So those are my points, Chairman. Thank you very much.
Thank you, Margaret. Chris, I think you indicated you wanted to respond.
Yeah, I'm happy to respond. I mean, certainly the mental health in schools teams waves. So the initial wave one, we did submit a bid for all areas. We did try to submit a bid for all areas, but there is a national marking criteria from NHSE which awarded the contract into South Warwickshire initially. We have continued to make bids across each one of those, and we do recognise the need that's there, and we'll continue to make bids to be able to support the enhanced growth of mental health in schools teams. But I suppose I just wanted to be clear that we did try to get all areas covered in the first wave, and the national marking tool is how we ended up with I believe a team in South Warwickshire. And obviously, as I say, on the third wave, we put a bid in again for the Nuneaton and Bedworth, and as I say, we were unsuccessful for a variety of reasons that have already been outlined. In relation to the blended model, I do agree with you that actually, there is a range of benefits and drawbacks to being in an entirely digital world, and I think that we are presented with a variety of difficulties. Children and young people present us with the anxieties of coming into a CAM service and coming and waiting in a waiting room, and those difficulties, and there's always a balance to be made. And I think that what I wanted to try and assure all of you here is that we haven't settled on what we believe is the final answer here, but what we've tried to do is be responsive, and we've tried to listen and to recognise. And I think what's an important part about the transformation work we've done and the bid we've asked for from children in crisis world is actually we're going to try and ask some very specific questions about what helps you, what's good for you, and for us not to sit here and say this is good or not good for you, actually trying to get to the bottom of what's going to help children and young people. So I entirely take on board your request to consider that, and that is certainly part of our work. We don't sit here thinking that we've got an answer, and we have to try and do that. And so there is still an option to come and to be able to respond to that. In terms of the early help question, you wanted to understand in terms of eating disorders and in children in crisis as part of whether early help responds and supports that. I think that certainly in the eating disorders world, yes, we would want to provide early help. It's a very complex disorder that's often very hidden, and I think that what the national lockdown did for lots of eating disorders, both for children and adults, is it exposed eating habits and programs inside of families. So where something might have been concealed before, as a breakfast was grabbed and taken off the table and was supposed to be eaten, but then went in the bin, and then the lunch that was prepared wasn't fully eaten, those sorts of things became became very apparent in families. So one of the things we did see is that national lockdown did expose that. We are keen to try and look at the pathways to be able to expand early help and early help support. We are certainly working and discuss the pathway with commissioners both in the transformational operations group, and we've talked about actually engaging early help and supporting with early help to get key messages out there. It's a complex piece of work for eating disorders because you have to be able to understand what are the flags, because weight itself and weight loss may not be just the important thing. It may be things that you are doing. So you have to understand the red flags from that point of view. But we will work towards that. But at the moment, we are also working with what we believe is, sort of really significant need. And we're trying to make sure our services are able to respond to that. Data was a question that you put to a statement that you put to us, and data for this report. And as I said, that as part of the national pandemic, a lot of the processes and support systems that we previously would use and the reporting requirements were not continued. Certainly, a number of the staff that were engaged in those activities would be deployed towards the national effort. Certainly, you are fully aware from watching the news the work that had gone on around ordering of PPE. And also the daily figures, and all of the people that would have been involved in that would have been deployed to make sure that the government had that information and support to be able to report. So that was a complex task. We are going back to our reporting cycle. Our next meeting's on the 11th of November, and had I had more information to be able to include, then clearly I would have we would do that, and we'll do that in future updates as we go forward.
And I think just to add to that, accept the point, we were asked to come and give an update around the transformation plan as opposed to performance. And as Chris has said, we have stood that down, but that is something that will be coming back online. And obviously through our quarterly performance reports that you get usually, that will start to come back in as part of the regular performance monitoring for overview and scrutiny.
Thank you. Just one quick point, Chairman, if I may. It was your response on eating disorders was really helpful, but I was actually looking more generally that early help on mental health issues that are neglected, if you like, may lead on to eating disorders and other things. So, but yeah. Anyway, so it's a more general thing.
Yeah, no, and certainly early help and the process of early help. So we have done some work around with our partners around how we get that response. Certainly, I've worked with early help colleagues in Warwickshire to make sure that we are thinking about what the broad range and the partnerships that we're talking about are ways of getting volunteers, etc. Thinking about when does a query or when does a small anxiety become an issue, and that's why we've tried to make sure we've got a range of different options. The Dimensions tool is a brilliant tool for families to be able to take control of their own early help and support, and we continue to champion that. But we recognise that actually the world's changed so substantially for children, and their pressures have changed so substantially, that we need to be open-minded to what the future is and what their needs will be as we go forward.
Thank you very much. Thank you. I've still got two members. Keith.
Thank you very much, Chair. I've been on the Borough Council Health Scrutiny 8 years ago, and there was a 104-week wait back then. It is really useful to get data. I totally agree with what Margaret was saying about the data shows us the throughput and the lags. It would be really good if that presentation we had today came before it. Some of the axes on it I couldn't quite read in terms of the vertical axes, that for weeks of delay or whatever. So please send us the presentations before meetings in future. And it is really bad waits we're getting at the moment. I have one particular resident who waited 4 months in the navigating hub to then get a letter from Mind, which was a template letter, basically saying in 2 weeks, tell us if you want to watch a webinar or not, otherwise we'll take you off the list. And so I think there's a lot of people falling through the system at the moment, massive delays, and then when they get through the system, they get a template letter saying, sorry, we can't offer the service we used to have at the moment. Would you like a webinar? If you don't reply, we'll drop you off the list. The whole system is failing, and you've got all this bidding, all this stuff to get money, but at the back end, we're not actually helping people urgently enough. And the point Margaret was making about the north of the county, we know there's incidents in Nuneaton, Bedworth, Aviston all the time with young people with serious mental health problems. We had a shotgun taken into one of the schools in North Warwickshire a couple of years ago. Yeah, there's people with serious mental health problems who need help, and the system's not picking them up. The delays are horrendous, and this navigating hub and signposting does actually need to result in them going somewhere and getting help, which is why the data is so important, so we can follow through that people are getting the help they need. And it is really appalling to think that Nuneaton and North Warwickshire is considered not to have problems like the South, because we have serious problems, and we probably have a problem that we're not quite so good at filling out forms. And the general social economic position is we're not getting the help because we don't, in Nuneaton and Bedworth and North Warwickshire, know how to ask for it as well. So I do really worry that we are going backwards. Thank you, Chair.
Thank you, Keith. I still have two speakers. I've got Jerry and Carl Hopkins. Jerry, are you there?
I am on my screen. I've got about another 1, 2, 3, 4 people.
Well, not on mine.
So, I don't know. I think the stuff being put in chat. So anyhow, I'll jump in. Can I thank you for the report and the update and the work that you've done, and I know the achievements and everything that's there. And there's a lot of good stuff that's gone in, and I recognise it's been a difficult time. But I partly have to echo some comments that have been made before. I don't get a sense from the report actually of the magnitude, the figures from it. I don't get any assurances around that. So if you like, it's a report of words, and it doesn't give me some of the contextual information, the broader picture stuff around it. And I didn't really get it from the presentation, to be honest, because that was really just a presentation of words. And the problem with Teams is we get loads of PowerPoints now, as you probably do yourselves, and they all sort of merge into one. And this is my third meeting today, so it doesn't bode well, really. And that's something more to do with the future of technology, I think, and how we interact with it. But the first point, I think, is something around the baseline data and the issues of that. And Margaret touched on that. And I hope that in there, because in paragraph 8, you actually acknowledge the pure fact that actually you've got to get a baseline data set together again, and you've got to bring that forward. And you're hoping that that's going to be done by the end of the year. So I suppose point one is, how confident are you that if I came to you on January the 1st and banged on your front door, that you could give me a complete data set up to date with all the figures in there, and that's there. And sitting alongside that, because paragraph 8 is the financial implications, and this contract is costing the county council and the taxpayers a lot of money, is how confident are we in the sense that we're actually getting value for money from the contract, even through COVID. There has to be some bottom line about this on that. So that's point 2. The other bit really was around paragraph 6.5, which is the increasing referrals and the complexity of cases. And I suppose that for me, if you marry those two up together and what's been said, are we seeing an increasing complexity of cases, which is what you're referring to, I think, and not just eating disorders, but the whole range of stuff coming through. If that's the case and complexity is increasing, that means the funding for early help and everything else potentially has to increase with it. We have to square that circle at some stage if we've got increasing demands, and that increasing demand is complex. That's it, Mr. Chairman.
Thank you, Jerry. Becky or Chris, did you want to come back?
Am I allowed to jump in as well? I don't know.
Oh, Jed, yes.
Yeah.
Yes.
As many people as possible.
Yeah, sorry, Jed Francie, Associate Director of Ops for Mental Health Services. Just to pick up a couple of points. I mean, the pandemic has had an impact on our ability to respond in a timely way. And I think nationally there has been a drop-off of referrals, but I think it is fair to say, as Chris has highlighted and Becky's highlighted, we have worked really, really hard to try and be as responsive as we can during a very, very difficult time. And what that's meant is we've actually redeployed resources to priority areas to make sure, for example, people in crisis, young people in crisis, get a very timely response. But it has had impacts elsewhere. And what I'd say is North Warwickshire is as high a priority as anywhere else in the county. I just want to assure members of that. I also want to say that
I'm not from North Warwickshire,
but just
from
generally,
Rugby.
just
I'm
generally,
talking about Warwickshire as a county, not about a specific area.
yeah, just generally. I mean, what we did during the pandemic was we rated all of the referrals that came in to make sure we understood which ones needed the most, were most in need and needed the most immediate response. And what I was going to say was any cases that people feel have taken too long, we're happy to pick up afterwards as well.
Thank you for that, Jed. Now,
and I think just to pick up, Chair, and I think Paul wants to come in and grab your attention, Chair, but just in response, Jerry, I think you are absolutely right. We are going to need to understand as we start to look at the data about what has the impact of the pandemic been, what will it be over the course of the coming months, and as we progress into this contract, and what does it mean for the specification that we have and the delivery of the contract. And that is all absolutely going to need to happen. I think what we tried to do today and in discussion with Jeff was just give some sense of some of the data, but what we were asked to do was talk about the transformation plan and where things are at around that. I do think it'd be helpful for us to come back at some point with a focus around the data and understanding linked in with the joint strategic needs assessments, the COVID recovery surveys that we've done, as to what do we now understand to be the likely demand for our mental health services moving forward, and what does that mean about how we direct our resources appropriately to meet that need. So I think it's absolutely something we're going to need to get a grip of jointly. So, Chair, yeah, I think Paul wanted to come in.
yeah, well, hold on. I've now got two hands up from members. I've got Carl and Marion. Now, unless there is anybody else, and I can't see anybody else, contrary to what you may think, I can see no further hands up. So I'm going to Carl first and then Marion.
Chair, Carl has never had his hand up. He's helping with the live casting, but the members who do have their hands up are Marion Humphreys, Corinne Davis, and Dan Usain on my screen.
Well, I've got Marion. I haven't. So Marion next. I haven't. I'll put Dan on, but his hand is not up on my screen. So Marion.
Right. Thank you very much, Chair. Yeah, I mean, I am a councillor in North Warwickshire, so I'm fighting for it all the time. And I've heard what's being said, but what worries me in the COVID time we find ourselves is the fact that we've got young children. They've been through the transition of going to school, going to secondary school in a very unsettling time for them. We've got children leaving school where they're not going to jobs. They've got jobs that they can't find because businesses are closing down. We haven't got an infrastructure for them to even transport themselves to go and find jobs. So they're becoming very isolated. So they're getting very depressed. And this is what we're getting through at the time now. And I think this is something that people haven't seen before, which is not on statistics anywhere, which is a growing concern in our villages at this time. And Borough know about it. Our Borough are being fantastic in trying to get resources in, but it's something, you know, we haven't got big webinars going on. We haven't got things going on because we, you know, if you shared your resources maybe, and it wasn't all in one place or in Stratford or wherever, it's something that we feel quite passionate. It's always North Warwickshire at the last. And I don't care what anybody says, that's the way it's always been, I'm afraid. You're doing a fantastic job and nobody would criticise that. But we just would hope one time it would start somewhere else and end in Stratford, North Warwickshire County, instead of the other way round. Thank you.
Thank you, Marion. Did you want to comment at all, Becky?
Yeah, I think, you know, I think just to reiterate the point that the service is absolutely a county-wide service that has the same offer and is appropriately resourced across the county to meet need. There are certain elements of some of the bids that we've gone for that have meant that criteria is slightly different. One of the key criteria is around admission to Tier 4 mental health beds, and the reality is that in South Warwickshire, at the point that we were working up to the data, were higher in terms of the numbers of young people who do end up in a Tier 4 mental health hospital bed. But we do recognise that there are things that we're looking to develop. So actually the community partnerships and the new approach to that is absolutely being developed and piloted within Nuneaton and Bedworth. We're looking at developments around the digital offer in Rugby. So it, you know, just to be clear, it is not always South Warwickshire, and we are looking at how we make sure that across the county we're able to test out and deliver new things.
And just of a note, in terms of the crisis team move, we moved the crisis team into the Nuneaton base in North Warwickshire. So the crisis team offer that's currently based there, and their outpatient support services based in Nuneaton for the county at this moment in time.
Thank you for that. Dan, did you wish, I can't see your hand up now, but do you wish to come back? Dan Gassain?
I am sorry. Did you want Mariam to come back first, or am I okay to speak?
No, you're through to speak.
Perfect. Thanks, Chair. So I will try and keep it to the transformation, and thanks for the presentation. I do have some points I'd like to cover, and I'll tie them into the transformation. But just for Mariam, with the kind of this issue of the north-south divide, I live in the north. I live in Nuneaton, but working in the ambulance service for 13 years and dealing with a lot of mental health patients, I can say as well that the issues people have in the south are the same as the north. You know, sometimes they're better placed in the north to get the help easier. We've dealt with patients in Stratford that we struggle to get help with, and different places. So just that point about the north-south divide, there isn't. I think that's more if you see what's happening in your area. And I've got now toddlers knocking on my door to try and come in. But one of the issues I wanted to talk about in the transformation was this whole some of the plans we've got for people accessing help. So part of my job when I did work for the ambulance service was obviously sending ambulances out to people in crisis and getting different things. And we'll see the police now, and some nurses have got together. Oh, sorry, I think someone's hurt themselves. Sorry, I might have to run off in a second. I think someone had an injury. But we've got the police going out now with a nurse, and the ambulance service won't engage in that. And Chair, do you mind if I run off and come back? Because I really want to come back to this. Is that okay? Well, I think someone's legs hanging off or something. I'll come back if that's all right, Chair.
Okay, go on.
Thank you. Cheers.
Chair, more than happy to kind of pick up the response if he doesn't get back kind of outside of this and share it.
Okay. Now, with the exception of Paul, who I'm going to bring in a minute, I have no further hands up.
I think Corinne's hand is up and has been for some time. I can see Corinne Davies.
Yeah,
no, I have now, but it hasn't been up.
Well, I put it up at the start, but anyway, yeah, just a few questions. I mean, some of them have been answered, but one of the things was that it was worrying that the numbers contacting the service dropped so dramatically in the early months of COVID, and I just wondered how you managed. I know you said you sort of had the digital response, but how did you ensure that young people that didn't have access to a computer or didn't have a smartphone were able to, or even Wi-Fi in their house, were able to contact the service? And then secondly, I recently had a complaint through somebody, and I'm waiting for a little bit more information to get back to you on it, because I obviously needed names and things. But the transition between adult services or children's services and adults, this is a young person that had issues dating back to when they were 18, but they are now 25, don't have any sort of special needs, and so therefore are not classed as in the children's services still. And I don't think this has been particularly seamless, and I just wondered if you could throw a bit more light on that. And then my final question would be that you said head teachers attended a forum with partnership on early help. Have you actually got the numbers on how many head teachers attended?
Right, okay, so in terms of relation to contacting the service, I mean, clearly, nationally, the numbers of referrals dropped in April and May across all services. What we continue to try and make sure is that we got communication out there to say that we were still open, we still have consultations, we still continue to try and see people, and actually, if there was an imperative to see people, then we would see them. So we reached out to a number of people to be able to make contact with them via phone. The digital Attend Anywhere program that we've put in place, we put that in place to be able to, it's part of a national delivery, because all mental health services, all health services that suddenly lost the ability to see people face to face in a safe and secure way needed to have another version. We accept that some people don't have access to digital forums, they don't have access to data. That's less so these days, but obviously if we need to see somebody, we'll continue to see them, and the data that we've presented shows that actually although we were at 20% of our contacts being digitally, 20% of them were also face to face in the same month. So we continue to see people, but obviously we needed to ensure that there was a that we understood the clinical imperative about what that was going to add to the value of the interaction, whether we would do something by phone. And for different people were on a different journey. One of the complex things about the start of the outbreak was to understand what that meant for an individual, because actually for some people one of the difficulties with going to school and those pressures and talking about those pressures, and when that stopped, that changed, that they actually didn't have a desire to continue to talk to us or to proceed on a continuum at that particular point in time. So it was a very complex world of trying to understand where people were at a given point in time. And as I've said previously, we accept that. We're trying to look at the ability for people to be able to drop into a session in their school. That's not an easy thing to do, but we continue to try and work at different ways and different strategies to help people make sure that they can continue to access support from us at the most appropriate time. We are seeing the rise in increasing referrals and in numbers now. We can see that coming through, and obviously we continue to work with early help to be able to support that. In terms of your complaint around transitions around 18 to 25, I mean, certainly we know that any transition points are difficult and complex. We do hold internal transitions forum meetings where we individually look at cases on case-by-case basis now. So it's not about arbitrary discussions. It is actually, or an arbitrary age range that makes the transition happen. We look at what's happening for an individual. We hold a forum to look at the numbers of people and try and make sure that we plan and accurately move people through that service and through that delivery. Obviously, if there's a specific case or a specific example you want me to look into, then I'm more than happy to look into that. But obviously, we do hold we try to learn from that, and we hold an individual forum. Your final question was the early help forum. So the early help forum with head teachers, we had a range of head teachers. It was a digital forum like this, so it was impossible for me to tell who was there. There was a range of head teachers that dialed into that. Early help facilitated it. Marina Kitchen helped support that. We recognised at the time that we were seeing them that obviously they hadn't got children and young people in their bases, in their schools at that time in the same numbers that they were having. And obviously what we requested and have continued to hopefully have set up will be an additional forum now that will get better intelligence of what school leaders and SENCOs and mental health supports within schools have, and actually talk to us about what they're finding, what they're seeing, how things have changed, how things have shifted from where we were in February when we went into a national lockdown to where we are now with children and young people coming back. And as you say, there are a range of complexities for those children that transition to secondary school without actually knowing it. Those children who are facing their GCSEs now, who've had 6 months without schooling, which is my household. So actually, there are a range of different difficulties and needs out there, and we're trying to make sure we understand those and work with head teachers on it.
Yeah, just picking up your first point as well, Corinne, in terms, I think, Jed, you put something in the chat about the reduction in kind of new referrals. Chris, do you want to just talk about what you did with everybody who was an open case with
Yeah, so what we did is made sure that anybody that was open, anybody that was waiting, that actually we got in touch with everybody via, and made contact with them to go, what's your circumstances? We are open. Where are you? How do you want to proceed with treatment? Some people wanted to pause at that point and actually said, there's enough going on in our household right now. Actually, with not going to school right now, the pressures have eased. So let's, we'll touch base with you. Some people that need increased, so we needed to provide more support. Some people we needed to provide less, and actually what we had to make sure is that from the outset that everybody was contacted. We did that through those people that were waiting to go into a particular group, or those that were in groups that stopped, and that's where we used some of our other staff to continue that work, to do that work online, to do that work on the phone. So we had a very complex job of trying to look at everybody that we were in connection with and make sure that we'd reached out, spoken to everybody, and if we couldn't get hold of you, that we'd written to you, that we'd done something to reach out to make sure that you knew where we were, and actually the plan, and agree a plan with you. And for some people that plan isn't right or wouldn't be right, so actually they'd come back to us or need to reach back out to us. But at those points when they do, then we will reevaluate where we are and how we can support you at that point in time.
Can I just
come back, Corinne? Yeah.
Just to say then that we don't actually know how many head teachers attended at all. I mean, will that be offered again?
Yeah, absolutely. I've offered to run it as a regular basis. I've offered it in Coventry and Warwickshire. The vehicle that Teams is, I'm more than happy to put a range of mental health professionals up for schools to talk to directly, to ask questions. There are no silly questions at this day and age for people that are trying to work with children and young people, and I want to give people the opportunity to ask whatever they need to ask, to either have the answer or for us to go and find the answer, or for us to work together to think of a new answer.
Is there a way to target the schools that haven't participated so far?
Yeah, I mean, certainly we have a whole school approach as well that we would do. I know that certainly Early Help have targeted schools with information. Mind made sure that they targeted schools. They had developed some information from the National Mind, and actually Zoe, who may be on here, maybe explain how you targeted additional information to all schools during the programme. So people knew what we were about, had up-to-date information, and we continue to be able to do that and provide that support.
Okay.
Just adding to Chris's point, just two things quickly regarding the head teachers conferences. Although we don't have the numbers right now, they were recorded, so all head teachers had a copy of the recording. So if they couldn't attend, they had a copy. They were invited to them. And regarding the information that was sent out to all schools, if you look on our website, the Coventry and Warwickshire Mind website, there's lots of resources that we sent out to schools, lots of newsletters that we sent out to schools from March until present day.
Thank you. Now, I do not have any further hands up indicating anybody wishes to speak. We do have another item yet to discuss on the agenda, so I'm calling a halt now on this subject and thanking Becky, Chris and Jed for their presentation. And we are going on to agenda item 4, autism and strategy update, which I think is being given by Alison Cole.
Yes, that's me. Thanks, Chair. So I've got a presentation to share as well, and I'm hoping I can make the technology work so that you can see it. Can you all see that now?
Yes.
Yes, great. So just to introduce myself, my name's Ali Cole. I'm a Joint Commissioner. I work across Warwickshire and Coventry on behalf of all of the organisations on this slide, and I have particular responsibility around learning disabilities and autism. So this strategy that we've been working on is an all-age strategy across Coventry and Warwickshire. The partners are outlined on this slide, and my team has been pulling together the work to co-produce the strategy with people with autism and their families and people working in services. Now, because this is a joint approach, I've got some colleagues with me today who'll be able to help to answer the questions. So from health, commissioning and provider organisations, Jamie Soden's here. He's the Director of Nursing and Clinical Transformation for Coventry and Rugby Warwickshire North, and Sam Davies, who's the General Manager from Coventry and Warwickshire Partnership Trust and has the neurodevelopmental service within her portfolio. It's really important to note that because this is an all-age strategy, we need to align closely with our SEND and inclusion strategy for Warwickshire. So Ross Cause is also here from Warwickshire representing education and SEND. So as I said, this strategy has been co-produced with autistic people and their families and people working in services. And we want to make sure that we continue that approach. So we will be establishing a new Coventry and Warwickshire-wide autism partnership group with representation from autistic people and people who work across the system to ensure that continued focus on co-production. So through this presentation, we're going to share an update, an introduction around autism, give some of the context and some of the key messages that we heard through co-production, and then run through the key priorities in the strategy. And then there'll be an opportunity to ask questions, and my colleagues will help me with answering those, depending on what they are. Just wanted to make the point as well that I'm going to mostly be using first-person terminology, so talking about autistic people, and that's reflecting actually the preference of many of the people that we work with through the co-production. So the first thing I want to do is just to show you this short video clip from the National Autistic Society, which gives a bit of a background to what is autism, which I thought would be useful context. So I just need to share that.
Autism is a lifelong disability which affects how people, like me, communicate and interact with the world. There are about 700,000 adults and children on the autism spectrum in the UK. And like everyone, each autistic person has their own strengths and challenges. But all of us have difficulties with communicating and interacting with other people. It could mean not speaking at all, needing longer to process information, or not understanding facial expressions. We also engage in repetitive behaviour, doing or thinking the same thing over and over. This is sometimes for fun, and sometimes to help deal with our anxiety. People on the autism spectrum can also find unexpected changes, however small, very distressing. And then there is sensory overload, where noise, smells, touch and bright lights become very painful and overwhelming. All these challenges can make the world feel very scary and hard to understand, and sometimes send us into physical and emotional meltdowns or shutdowns. It is very important that autistic people get help from an early age. But life can become very difficult if children or adults don't get the right support or understanding. Autistic children are 3 times more likely to be excluded from school. Only 1 in 6 autistic people in the UK have a full-time job. And over 1/3 of autistic adults have reported serious mental health problems. The National Autistic Society is the UK's leading charity for autistic people. Since 1962, we have been changing society's attitudes and transforming individuals' lives. We want to create a society that works for autistic adults and children, and with your help, we can.
Okay, just go back to the slides. So I'm hoping you can see the presentation again now.
Yes, okay.
manage the technology. Good. So just wanted to give that introduction so that everybody's got a bit of an introduction to autism, and just noting as well in terms of terminology, some people will have heard of Asperger's. That is a type of autism, and it is often a term that's applied when somebody has particularly high intelligence and autism. So autistic people, some autistic people have a learning disability, some don't, some are very highly intelligent, and we need to make sure that we're thinking about all of the people on the autistic spectrum when we're talking about this strategy. So just some context to why the decision was made to develop a 5-year strategy. So we know that we've got statutory responsibilities to support autistic people. This includes the Autism Act from 2009, and there are implied responsibilities within the Care Act, the Children and Families Act, in particular SEND Code of Practice, and the NHS Long-Term Plan published last year has a specific focus within that on people with a learning disability and people with autism. It's really important to note that many autistic people do live independently without any support from statutory services, and they have satisfying careers, go to university, raise their families. However, people and families have told us they're driven to seek a diagnosis because their needs are not being met and they need more support. In line with the national picture, locally we've got an increasing demand for any service that is commissioned for autistic people, and particularly there are long waiting times for diagnostic assessments, and this is compounded by national workforce shortages in specialist autism roles. As referenced in the video we saw, there are stark inequalities experienced by autistic people, and particularly too many autistic young people and adults locally are admitted to mental health hospital or are accessing high-cost specialist services in education and social care, such as residential schools or colleges, which means that they end up having to leave the local area in many cases. We know that resources are limited, so through this strategy, we wanted to make sure we're prioritising our effort and investment into things that will make the biggest difference. And it is worth noting that there is a new national strategy anticipated, but we don't currently have timeframes for this. So we're progressing our local strategy to ensure we don't lose momentum while that national strategy is in development. So key messages that we got from all of the co-production and research that we've done in developing this strategy. So the first is that we need to meet people's social communication and sensory needs without requiring a diagnosis to access additional support. So it's important to note that when we look at our diagnostic service, 30% of the people who go through that service will not get an autism diagnosis following assessment. They still have social communication and sensory needs that require support. So we need to make sure that we're really prioritising making that support available to people while they're waiting for a diagnosis and even following that diagnosis, because they may not actually have autism. And while people told us that a diagnosis is really important for some people to help them understand themselves, and if they've got particularly complex needs, to help services and families support them effectively, many families actually told us that a diagnosis alone is not sufficient to meet their needs, because we've got gaps in our specialist services, and our mainstream services also don't always have the capabilities to support autistic people. And people told us that was a particular priority within mental health services, including CAMHS and education. We heard a lot of examples of really good support, but people had often struggled to find that support. So we know that we need to focus on making that support and pathways easier for people to find. There's lots of things available in the communities, but people don't know which things are going to be most effective for them or how to find them. So that's an area that we need to focus on. People also told us they feel they only get support once they're in crisis, and that drops away again once the crisis is resolved. So we need to make sure that we are supporting people earlier. We also heard from professionals that they struggle to find enough organisations in the community with the skills to support autistic people. So even where there's assessments of need and funding available, actually we don't have the organisations out there always to support people. So we need to develop that. And many people working in those services said they didn't feel very confident supporting autistic people and wanted more training. We know from the video periods of change are often more difficult for autistic people, and families really highlighted transitions as a priority. For example, primary to secondary education, but also particularly in supporting that preparation for adulthood. A really key theme in this strategy is understanding that autistic people's well-being really depends on them feeling accepted and understood in all aspects of their lives. And I'm sure you can imagine that can be a particular challenge if you find social communication and interaction difficult. People talked about the challenges they experienced locally, including at work and in their leisure time, that impacted on their mental well-being and in some cases led to significant anxiety or depression. So the strategy includes a commitment to develop autism-friendly local communities and services so that we can support autistic people to access housing and employment and benefit from the cultural, sport and leisure opportunities that we should all be able to enjoy. As I said before, there is no new recurrent funding identified to deliver the strategy, but we do recognise that autistic people currently access high-cost support from a range of specialist services. So what we want to do with the strategy is ensure our existing resources are used in the most cost-effective way. So that includes promoting prevention and early intervention, making our existing services and pathways of support more effective. We don't know whether there might be additional funding that comes out through the national strategy, and we are making good use of some non-recurrent funding that's available through the NHS and the Local Government Association to deliver our priorities for this year and next year. I suppose it's really important to note as well that delivery of the strategy objectives is going to require system-wide commitment to prioritise the needs of autistic people within wider programmes of work. So we've talked about SEND and education, but also thinking about primary and secondary mental health and physical health services, thinking about our social care and support, public health, our communities, housing, our businesses, police and probation. So the strategy has 5 key priority areas and a number of deliverables within those. So this first one is about supporting autistic people and importantly those with social communication, sensory and emotional health needs to help themselves before diagnosis and post-diagnosis. So we want to improve the early identification of characteristics linked to autism across primary care, nurseries, schools, housing and wider services, and for people to know more about how to support someone with social communication needs. We need to reduce the need for a diagnosis to access appropriate support and ensure that the support we give is based on need, not diagnosis. And we will do this by providing information and advice to people who have those needs, including parent training and some really practical tools and techniques that families and professionals can use to support people. We want to enable and empower people to develop their own solutions and networks of support in their communities through developing a better understanding of the third sector services people are using, enhancing peer support networks and facilitating information sharing, including thinking about what opportunities are presented through the social prescribing offer that will come on through the new primary care networks. Our second priority area is about reducing inequalities and making Coventry and Warwickshire autism-friendly places to live. We need to be clear as a system that it's the responsibility of all services to ensure accessibility and appropriate support for autistic people within their service. We know we need to prioritise the development of inclusive education and mental health services, but in order to make a real difference, we need to deliver wide-ranging training beyond statutory services. We particularly need employers to recognise the benefits of employing autistic people and to be aware of how to make workplaces more autism friendly. And we can start by committing through this strategy as NHS and local authority employers to doing this. Our third priority is about developing that market, making sure that we have those providers locally who can support people. We need to improve our awareness of the support that's already available from charities and third sector organisations, and we can facilitate that by holding regular conferences to link providers together so that we facilitate sharing of best practice, partnership working and pathways between support organisations. We are working to develop more supported living, day service and respite providers for autistic people through the recommissioning work that we're doing. And similarly, we want to improve the range of options for autistic young people in specialist education and post-16. So we're supporting that preparation for employment and adulthood and really ensuring people can access the support they need within Coventry and Warwickshire. We plan to enhance the skills of our existing workforce and want to have a consistent approach to doing that across partners in terms of our autism training so that we're all talking the same language and have the same tools and techniques for supporting people. As part of this, we're leading work across the West Midlands to bring commissioners together to develop the workforce skills in this area. And through CWPT, we're part of the Oliver McGowan National Pilot for mandatory training, which will be applied to all health and care staff in learning disabilities and autism awareness. Importantly, we plan to work with universities and colleges to ensure that the next generation of professionals and support staff join the workforce with the skills they need to support autistic people. The fourth priority is acknowledging that for some people with autism, they will need a specialist support offer. So we need to make sure that that is really well coordinated and a personalised offer. We want to promote early intervention intervention, but also really make sure that people can navigate this offer as their needs change. So as their needs increase, they can go up, and as their needs decrease, they can come back down to a lower level support offer. This includes redesigning the diagnostic pathway and focusing on developing an all-age pathway to support better transition from children's to adult services. In redesigning that neurodevelopmental pathway, we'll focus on building capacity and capability across services to undertake diagnosis as part of the assessment within that service. For example, thinking about opportunities to do that within mental health, CAMHS, paediatrics and educational psychology services. We need to build capability within those same services to deliver appropriate interventions and care plans which recognise the impact of autism on those care plans. That will then enable us to redesign the current neurodevelopmental service to focus on providing specialist advice and support to wider services, and to undertaking diagnostic assessments for people with more complex needs. We know there are gaps in specialist support for autistic people following a diagnosis. So that includes people who are in mental health crisis and those in the criminal justice system. Learning from the pilots that we've done over the last 2 years tells us that we know people need a holistic assessment which will determine the underlying factors contributing to that crisis, which may include autism or another neurodevelopmental condition. There may be issues relating to attachment, trauma or mental illness. We then need to ensure following that assessment that specialist therapeutic input is available for autistic people. This may include psychological interventions, speech and language support, sensory support and family therapies. Key workers it's a term that was coined in the NHS long-term plan before we had key workers from a COVID sense. So these are new roles that work across the system to support autistic people and their families to navigate the system and really advocate on behalf of those families for the support they need. They will also support the transition from children's to adult services. And the existing preparation for adulthood programme within the SEND change programme will also include a focus on autistic young people and supporting their transition. Our fifth priority is around ensuring we maintain that strong commitment to continue the co-production approach used to develop the strategy. When we were developing the strategy, we met lots of people who are full of energy and passion to help us improve the current offer, and we need to make sure we continue to harness that. We're part of regional and national work programmes to ensure we continue to learn from others and share the good things we're doing. The national evidence base on what good looks like in services for autistic people is still not well developed, and we want to contribute to this through the work that we do. We don't know enough about where autistic people are in services, and we don't routinely collect this information across services, and we often include autistic people within disabilities cohorts or mental health cohorts rather than seeing autistic people as their own category, and that makes it more difficult for us to evaluate how well autistic people are being supported and to understand where we can best invest our money to support them. And of course, this year has highlighted additional inequalities experienced by autistic people and those with disabilities during the COVID pandemic. For example, for some autistic people, the move to a virtual offer has been fantastic and has enabled them to engage in a way they've never have before. For others, it's made services completely inaccessible. We need to be really conscious of this and redesign services accordingly. So in terms of our next steps, the strategy is currently going through all of our partners for input and comment, and once we've got the final version, that will be then going to our CCG governing bodies and cabinets to be formally signed off as our joint strategy. While the strategy gives overarching objectives for the next 5 years, and we will look to deliver those in a coordinated way across Warwickshire and Coventry, we recognise that some elements will be delivered differently in the different places to take account of different services and communities in those areas. So we're currently working on developing more detailed place-based delivery plans about how exactly those objectives will be delivered in each area. We have already agreed activities for 2020 and 2021 as outlined on the slide, and these include redesigning the neurodevelopmental pathway, developing our early help and support offer, workforce training and developing our specialist services. And I'm happy to give more detail about any of those if anyone would like it. So that is really quite a whistle-stop tour through the 5-year strategy. But I'll welcome any questions.
Thank you very much, Alison. Corinne, I know I have at least 2 questions from you. If they're still applicable, do you wish to speak?
Yes, please, if I could. Thank you, Alison, for that strategy. It's really interesting to read it, and lots of good points in there. I just wanted to ask a couple of things. Obviously, one of the aims is from the SEND initiative that we were discussing earlier on in the day, is to cut down the number of education healthcare plans for young people. And so obviously, if this is the case, then what we really need is more and better training for schools to take on board with regard to recognising autism and the early needs that people may have, so that we can obviously prevent that from escalating. So I just wondered if you knew how many schools have actually sort of undertaken any training on autism at sort of level 1 and level 2. That's one of my questions. The second thing is about the bit I was reading about the criteria and diagnosis of autism for males and females, and I know I was reading something further on from that saying that they think that that's actually underrepresented in girls, and that a lot of the diagnostic tools are geared towards diagnosing this in boys. So therefore, what can be done to make sure that girls are actually getting the diagnosis that they also need? It also says that the prevalence in Warwickshire is not over responsive. But actually, I just wonder whether perhaps in other areas it's actually underdiagnosed, and therefore I just wonder, again, the waiting lists are still very long in diagnosing people, and what are we actually doing to tackle that? And then my final observation really is that it's a little bit worrying when it's called a disability, a learning disability, and in actual fact lots of young people are perhaps, when they get into the world of work, they are reluctant to disclose and therefore get the help they need because they don't want to have that label put on them. And perhaps we need to address the way we address young people, basically. Okay, thank you.
Thank you, Colin.
Thank you.
Alison, do you want to come back?
Yeah, so the first one around autism training, I'm going to bring Ross in to respond to that question.
Hi, Corinne. In terms of the data, since 2018, 125 of our schools have done the Tier 1 training or the Level 1 training, and 24 schools have done the Tier 2. That's whole school trainings. The total staff trained is 3,572. We have 247 schools in total, if we include our special schools. A few less if we take those out. So it's around about half. I know we had a good discussion about training on the SEND programme earlier, and clearly there's a need to link up with this agenda as well. I think I explained there in terms of as we go forward, we'll be working across teams to bring that together in terms of the workforce development, working with teams, and indeed working with Chris and Jed in terms of the workforce development around mental health needs as well. We'll be part of that.
Thank you. Corinne, do you want to come back?
Yeah, just on the schools that have actually not sort of taken part in that, is there a drive to get the other half of the schools to get on board? Because that's actually quite a lot that have done it, but it's a lot that haven't.
In terms of we can't make schools do it, we can keep offering it and trying to do that. That's why we do need a concerted effort and a planned effort in terms of what should the workforce development package look like. As I said earlier, do we want to really push the autism training, which we have been doing? That's been our focus, or the trauma or attachment, or a kind of a collection of all of those and more together. So I would say that whilst we're still promoting that training, and Eve Godwin, my colleague in the specialist teaching service, leads on that. I do think as part of the SEND programme, we need a more coordinated and planned kind of unified effort across not just council teams, but across partners to say this is the essential training that we think all schools need.
Okay, thank you. I have one hand up, Margaret.
Thank you, Chairman. Thanks very much for this report, and I really like this idea of an autism-friendly society. It's a bit like the dementia societies that we've been trying to create, and that's a good model, I should imagine, to base this on as well. And that's really to be promoted, and I hope that we can all be part of that, because that's excellent. I'm a little bit worried about this diagnosis business. I mean, I understand what you're saying. Basically, what you're saying that, you know, people should be provided support right from the start as soon as any problem is identified. However, I know that in the north, and I'm not sure about the rest, to be honest, I'm sure it's just as bad. We've got about a year's waiting list to get a diagnosis of autism. Now, I understand that a diagnosis doesn't change very much, except that you know whether or not this person's got autism, and, you know, possibly what sort of support would be most applicable. And that's my issue, really. Diagnosis is a key at the moment, a key to a door, sometimes of funding and often of the right type of support. And I'm not sure, knowing the way a lot of schools work, some of these indicators, if you like, of possible autism could be dismissed as poor behaviour in school or whatever. So it won't be identified necessarily as a communication problem and something that can be addressed in that way. It'll just be dismissed, and these children will be suffering as they do now. And so I don't wish to sound rude, but this report sort of says we've got a really long waiting list for diagnosis, which we can't cope with, so we're going to do something instead. Now, I understand that it was with the very best of intentions, but we really do have to address this issue of diagnostics, because it is the key to many people. And I was very interested in that little short film, which was very informative. And it says, you know, it's really important to get help from a very early age. And without diagnosis available, that could be at risk for a lot of youngsters. So I am really concerned about this. I just think we have to get to grips with this diagnosis and provide the support as well. Thank you, Chairman.
Yeah.
Thank you, Margaret.
So,
Alison?
yeah, I would entirely agree that the diagnosis is really important. It's really important that we raise awareness of that, so that people know that they are considering autism or other social communication issues when they see behaviours in school, for example. And actually, coming back to what Corinne was raising about girls and boys, actually often that's part of the reason why girls go underdiagnosed, because their autism doesn't often present in challenging behaviour in the classroom. They sit quietly at the back. And then their anxiety grows because they're finding at school so difficult to cope with, but doing it quietly without telling anyone. So I absolutely agree, it's really important. The really difficult situation for us at the moment is that the referrals to the diagnostic service are 4 times the number of commissioned assessments. And actually, despite repeated efforts, because of the national workforce shortages, we're not able to recruit more staff into the service to even deliver the number of assessments that we've commissioned. And even where we try and get them from other providers, from St Andrews, for example, they have the same problem, that they're not able to provide the number of assessments we're asking for, because this is a national problem. So what we've done is we've looked at it and said, well, there are some people where actually we could provide better support without a diagnosis. So some people's needs are not very complex, and actually we've had real success in places like Worcester, where they've invested really into support. So the services that we've commissioned through, for example, Coventry and Warwickshire Mind, so Zoe's on the call today, where we've commissioned support for children and adults, which is available pre-diagnosis, which really looks at what are the practical tools and techniques that schools could use, that families could use, that people can use themselves to really try and get to grips with with getting the right support and getting environments that are more accessible for people. The other thing that we need to be doing is really targeted training across our wider workforce to think about where we can do that diagnosis. At the moment, we're targeting everyone through quite a small neurodevelopmental service, and clearly we can't meet the demand there. So we need to think much more broadly about our workforce. So that's why there's real key focuses in this strategy on support and workforce training. So it's not saying that diagnosis isn't an issue or that we don't need to tackle the long waiting times. It's saying that actually just putting more money into that service, we don't believe will deliver what we need it to. We need to focus on the support and getting more people to a point where they can do that diagnosis without someone having to go to a specialist service for it. Does that Does that make sense?
Absolutely, that's really good. Chairman, could I suggest that this is the first time, probably it's me rather than, it's the first time I've realised that one of the reasons for the long waiting list is the fact that we are not, or the services are not commissioned for the right number of assessments. Now, I assume this is from the CCG, correct me if I'm wrong. We really ought to be writing as a joint unit to the CCG and saying we are really concerned about this. This is an issue that keeps coming to our attention. And if you're not commissioning the right services, why not? You know, so I would urge, Chairman, that we use our influence as an organisation to push that agenda forward.
Point taken, Margaret. Yes, I've made a note of that. Keith.
Chair, as the Director of Nursing and Clinical Transformation from the CCG, would it be helpful for me to just quickly respond?
Okay, but if you would be brief.
I suppose I'd just pick up on the point that Alison has made, that we've known for some time that actually we can commission as many, but there isn't the ability to get the staff or the services to deliver them. So the issue is not a lack of willingness to commission them, it's the lack of availability of resources from that, which is one of the principal reasons we've tried to look at this from a different perspective.
Thank you very much indeed. Thank you for that. Keith Condicle.
Thank you very much, Chair. Data on Table 1's very interesting, showing the predicted number of people affected. It's interesting you say there's probably a lot more, but obviously being a spectrum, it depends where you put the cut mark. But I'm really interested, particularly some of the stuff that Margaret was talking about and us and Corinne about underdiagnosed females, because I do think being a fellow with strange behaviour is harder than being a female with strange behaviour in terms of being noticed. Also, it's interesting about Asperger's and that sort of other end of the spectrum, where you've got some really high achievers that can be lonely and have mental health problems because they're not fitting in, whereas actually they've also got lots of skills and my background is electronics, and there's lots of people I'm sure are on the autism spectrum who would get involved in it because it's very technical and very nerdy, shall I say. But it'd be interesting about how we help those people. And also you talked about peer networks, and obviously I don't think I'm properly autistic or Asperger's, whatever. But yeah, I got involved in computers back in the 80s, and there was a support group of people who were like getting involved in computers, and I'm sure there's people involved in like getting involved in comics or all sorts of other sort of boy activities. So can you just tell us what sort of things we can try and do in terms of peer networks that don't necessarily cost as much, but just sort of point to people to interest where they can help each other?
Yeah, absolutely. I don't know, Zoe, sorry to put you on the spot. Do you want to talk a little bit about some of the networks and groups that you've been supporting?
Yeah, I was literally just thinking that part of the Community Autism Support Service, there's lots of support that happens within that. So it's needs led. So if there's a group of young people who are interested in technology, then that support is sought. That interestingly, during COVID, that's been the biggest success within our service of transferring over to digital support. And I don't know why. We thought that it was going to be, more challenging, but actually young people have really taken to it. And I think it's because maybe it reaches, the aspect of their brain that takes away the aspect of socialising face to face. So yeah, groups are happening weekly. Peer groups are happening weekly. Games, we use forums like Kahoot. Young people are leading on devising different questions. They're doing different activities like cooking, crafts, you name it. It's all happening within the Children's Community Autism Support Service.
Do you want to come back, Keith?
No, that sounds like a great bit of work, and the more we can encourage people to get out and do things, the better. And it's one thing, it doesn't cost a lot, and it's just trying to get people to do stuff. But one thing I was wondering is, do we also do things to actually get people to mix, girls and boys, or people? Yeah, obviously you don't want to channel them too much into be less sociable with others.
Yeah. So I should have said that all of the groups are mixed at the moment. It hasn't presented as itself as a need to, have separate boys and girls groups. So it's more mixed within age groups. It's more mixed within groups that display, a keen interest in different areas rather than gender groups. And the other thing that we've done very recently that we're trialing, we've compiled big packs of, all different arts and crafts and marshmallows and all sorts that young people can do as a collective. So, they can make crafts as a collective and see each other making the same crafts. We've received a lot of positive feedback on that. And actually, we have consent to share a photograph if you want me to share it within this forum of a young person holding his craft bag.
And I think there are some people, aren't there, Zoe, that we've had to do some one-to-one work with actually around social skills for them to feel comfortable to even join a specific support, peer support group or social group with other autistic young people or other autistic adults. So it is something that we have to work quite carefully to get people to the point where they're joining the right groups where they feel comfortable.
Yeah, absolutely.
Thank you.
Chair, can I just ask, can people go to these groups before they're diagnosed if you're sort of...
Yes.
Yeah, so the group is pre and post. So the pre being, as long as they're on the neurodevelopment waiting list, they can access the support, and then following a diagnosis, or any young person that's had a diagnosis and presenting with a need can come to our support groups, and like Ali said, the one-to-one support. And also we work quite closely with the schools. So it is, a system-wide approach.
Thank you. Pam Williams.
Yes, good afternoon. Thank you. And thank you very much for bringing the report. It's very interesting and very well presented. Thank you. I'm very concerned about young adults who haven't been able to maintain employment. I've recently met a young woman who's 42. She's highly qualified. She's got A-levels, O-levels. She's got degrees coming out of her ears. She's extremely well qualified, but she's never had a job, and she's recently been diagnosed with Asperger's. So she is now developing strategies to deal with that. But what she feels very strongly about is the fact that none of the people who have ever employed her have been aware or have any understanding of the support or the way that she works. And now that she has been diagnosed and has a better understanding of it herself, and she's developing her own strategies, she feels that this is something that needs to be put to employers so that they can understand. And it's not just the diagnosis, there's a stage before diagnosis, there's a stage which I would say is recognition. Because I think there are a lot of people who have a feeling that there's something amiss and they're not quite interacting. They have difficulty with relationships and many other things. One of the things that she found most difficult was actually finding her place, one place to another. So lots of little clues there that there might be something. But I think this sort of information, the basics about before you get diagnosis, the basics about autism need to be brought to attention, public attention, if you like, so that if you have any of these difficulties in life, that you can say, maybe I need to have a diagnosis. So diagnosis is one thing, but if you can develop strategies that will help with some of the behaviours before you're diagnosed and help employers understand before people are diagnosed, because there is, she really didn't want to have a diagnosis, and she feels that if people had helped her prior to that, she would have been able to manage, and she manages so much better now that she has these strategies in place, and she has just gained employment, which is amazing. So I don't know how you feel about that, whether we can look at
totally agree. Yeah, absolutely, totally agree. And they're exactly this, sadly, the same stories that we heard through co-production. So that's why we've got a focus within the strategy on those autism-friendly communities and autism-friendly employers. And as I said, I think we can start by making a commitment as employers ourselves in NHS and local authority organisations. Sadly, I heard stories from people who'd not had successful employment in our local NHS and local authority organisations even, and then felt, well, if I couldn't make it work there, I had no hope in the private sector. So I do think that absolutely it's that about that tolerance of difference, isn't it? Somebody talked about dementia friendly schemes that have been run. I think we need to be looking at something like that across Coventry and Warwickshire that really promotes autism and being more autism friendly. I think it's a really good point.
But I think also for people with autism or any variation, then looking at the strategies that help them to cope in life is one of the things that she feels that very strongly that I don't know if the Autistic Society does anything like that, but she couldn't find anything. But now she's trying to look at ways that she can work her way through what she finds difficult situations.
Right.
And have strategies for that. So I don't know whether any work's being done on that, but I think that would certainly be helpful.
Yeah, Ross, would you like to talk about supported internships?
Yeah, I can just briefly. So one of our programs from SEND is to help young people with special educational needs and disabilities into employment. This is a national scheme in terms of supporting internships, but actually most of our supported interns have had autism. That's the primary need that they've shown. We hosted 3 at the county council in interns last year, and as part of that as well, we've set up an employers forum. Talking about how they can meet the needs of with a range of special educational needs, but including autism, what to expect and how they can accommodate that, and really showing the value that our young people with autism and other needs can bring to the workplace as well. So that's, I mean, it's only a small part of the picture that you're painting in terms of employers. But it does show some of the work that we've been doing, and I know that's been supported by the council as well. I think Councillor Seckham hosted the first meeting of that employers forum as well.
Okay, thank you very much. Thank you.
Thank you. Margaret, you still have your hand up. Do you want to come back in?
Oh, sorry, Chairman, it's showing down on my computer, but no, thank you.
Okay.
Chair, I
Marion.
think Councillor Humphreys, Chair.
I know, I've got her. I've got her. Marion.
Hi, I'm here. With the Autism Friendly Society and also working with the criminal justice system, I worked in dementia for 35 years at the Manor in Nuneaton. And one of the ways that we did engage with the police especially was with the Herbert Protocol system, which was paperwork that they used, which we wanted to use in the community. And if you can find some way that you can attach yourself with some useful paperwork system with the police, then you find that you've got a way in to talk to the police and the Justice Department at the same time, because that took about 6 years of actually slowly working when I was at work, and now I'm a councillor. They've still taken it on as well, and they are very, very active now in using this paperwork. And this is if somebody with dementia did go walkabouts in the wrong direction, say, they have this information on their computer, on their long system to say who he is, where he's gone or where she's gone, and it helps in finding them in a very safe manner. So you need to, you know, and we actually used, as we've said before, the friendly dementia areas in shops, and how do our clients and residents act as they go into a shop. So if you've got paperwork where you can work with the residents in the shops and tell them what you want, that's what helps first of all. And what you want from the police, that's what we found really helped.
That's really helpful. Thank you.
Thank you for that. Thank you for that, Marion. Now, I do not have any further hands showing.
I think I can see 2.
I've got one. No, I've got one just come up. That's Caroline.
Thank you, Chair. I think this is a great strategy. I really welcome it. So thank you for the work that you've done. It's a really positive step forward. My question is with regard to schools. I think you said that training was going to be mandatory for teachers. I certainly hope that's true. A lot of things, complaints that I've had from schools is around teachers treating children with autism as being naughty and trying to discipline them, and that just causes them to not want to go to school and to become suicidal and self-harm and so on. And there's a particular problem with PE teachers, especially as the children can't cope with the discipline that they're wanting and the regimented style that they want to teach them with, rather than finding out what can you do and how can we help you. The teachers try to force the child to fit in with their regimented routine, and that just makes life impossible for them. So if we can expand the education of the teachers, and if it is mandatory, then I would really welcome that. Thank you.
Well, thank you. So I did talk about mandatory training. Now, currently, that's what's come out through the NHS long-term plan. The Oliver McGowan programme nationally is about mandatory training for anyone who's working in an NHS commissioned organisation or a social care organisation. It doesn't cover education, but I know Ross can give a bit more information about what we're doing in Warwickshire around autism training in schools.
Thanks, Ali. So we had a good conversation at the Children's ONS this morning regarding training. So just to be clear, what was one of our projects in the SEND programme? We'll be looking at more broadly at what training do we want all schools to do. And what I said there was we hadn't agreed what that package was. We can't make it mandatory for schools, but we can set an expectation, and we can also set guidance in terms of the support that we believe all schools should be delivering to meet a range of needs of what we call the targeted offer. So that's one of our projects that we seek to put together. Just also to say on that, in terms of the SEM programme more widely, which we launched with head teachers last week, and we were fortunate enough to have Dame Christine Lenahan from the Council for Disabled Children present at our head teachers conference. Really kind of challenging schools. I gave the example this morning of saying rather than schools feeling our children's school ready, are actually schools ready for the children that they're receiving. And there's also a tone here which I think the local authority can set in working alongside our schools in terms of saying how I explained this morning. The conversations that we need to have around our children with SEND, including those with autism, is how do we support them in the setting that they're in? And that goes through to quality first teaching right in the classroom. It doesn't just stop at the SEND coordinator or the head teacher. So how do we support them, and how do we get not only all our local authority staff kind of saying how do we support their child where they are, but also schools challenging each other on that. So there's plenty of work to do on that. But that is part of our SEND Inclusion Change programme. Thank you, Chair.
Thank you very much indeed. I do not have any further hands up at the present time. I just want to go back to Corinne and her questions. Corinne, did you get all the answers that you wanted?
Alison and I have been chatting on the chat
Okay.
thing, and she's going to forward those to me. I have had confirmation that the priority is to get the waiting list down, but yeah, she's going to send me some messages.
Okay, thank you for that, Corinne. Okay, no further hands up, so I am now going to refer us back actually to the recommendations, which the first one was for the update on the rise, asking us to note the following updates, etc. I am conscious that there were a number of issues from members which really require an update. So I shall be looking for an update, a further update on the RISE delivery. I shall also have to take into account, of course, we do have May elections next year. So at the moment, I'm thinking of asking for an update to be brought back to the joint committee, possibly sometime like July, as we will possibly have new members joining the committee. So I think perhaps an update around about July time might be appropriate. Does that meet with general approval from members? I shall take that as yes. The next one we have was for the autism strategy update, and again we are asked to note the progress on that. And I have made a comment, a note regarding the comment made by Margaret Bell, referring to the CCG. So my suggestion would be that with an update on that occurs at the same time, possibly in July, if that meets with general approval.
Yeah.
Okay. Yep. Thank you, Margaret. Okay. Well, I think that actually draws the meeting to a close. Could I thank all the officers who have presented today? It has been very much appreciated. It's been a long session, but I appreciate the commitment given by officers in presenting today, and of course to our members showing so much interest and questions. It is so much more welcome to have our officers questioned. That's what we are supposed to do. We are an overview and scrutiny committee, and that's our purpose. So thank you all very much indeed for your attention today, and hope to see you soon. Thank you.
Thank you, Wallace. Thank you.
Bye.
Bye, everybody.
Bye.
Bye.
Thank you, Chair. Chair,
Thanks,
can we have a
Polly.
copy of the
Bye.
slides for the RISE attached?